You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in pain management? With us we have the desert's leader in pain management, Dr. Roland Reinhart. Dr. Reinhart, always a pleasure
to
have you on the show.
Nice to see you again.
10-year anniversary for your center. A lot has happened in that time.
Yeah, well actually I've been in the desert longer than that, but 10 years of solely treating patients' pain problems.
Are you that better now than you were 10 years ago when I first met you, or 8 years ago when I first met you?
Well, you know, Randy, we all get better with age.
Okay, okay.
I like to think that we get better. Certainly our experience has gotten better and better. And again, technology has gotten better. Well,
if you're better, what parts are you better at?
Well, pretty much in every area. I mean, some of it is having the knowledge and experience, certainly in terms of injections. If you went golfing twice, how well would you do? If you golfed 100 times, and if you golfed 1,000 times, how much better would you?
I mean, other doctors will send you their wives.
Well, we do.
Their patients.
We do. And actually, the most flattering things I would say over 10 years is that the #1 referral source is our patients who we've already seen before. So that in my mind is the biggest compliment to our practice. So that's the largest part, and then physicians after that. Our goal was really just to provide the best service and I think really to take care of patients like we would our family members. That's what I think maybe sets things apart. Is really we treat pain like it's an emergency.
Do you really?
Yeah, absolutely we do. Imagine, if your mother was in pain, or if one of my family members was in pain, you'd want them to be taken care of right away, and that's what we do.
You take same-day patients. If they call, they're in pain, they could see them.
Right. And again, that's, our front office is empowered to kind of listen to the complaint and get the patients in as quickly as possible.
So if somebody's waiting a long time, we've talked about it before, they could either wait on their couch for 2 weeks to get in elsewhere, or wait a little longer in your lobby or your reception
area.
area.
If they come in, we do have our schedule, but we do take, if patients call in and say they're having pain, we'll work them into the schedule. We did have a period about, probably 5-6 years ago, where actually we set the schedule up so everything would run and everybody would be in right on time on their schedule. Within 2 days, we had so many complaints from patients who are used to being able to call and say, hey, I'm having pain, can I get in? That the complaints far outweighed the comments that, well, I had to wait for an hour in your office or an hour and a half in your office. So I suppose in looking at my practice, I sort of think, well, if the worst criticism someone has of me is that they had to wait for a few hours in the office, okay, I would tell you basically we're making sure that we're taking care of the patients, making sure that if you want to come in and your story's complicated about your pain, a lot of times we see people who have pain for years, and they want to make sure that I understand their pain. I want to make sure that I get the full story for them. And again, that helps a lot in making the right diagnosis. If you don't listen to the patient and get the full history from it, it's very hard to maybe make a correct diagnosis, or maybe you do things that aren't maybe the most efficient in terms of getting rid of their pain. So it's critical to listen to the patient.
Are you ever surprised after all these years, 10 years, with the results you're getting now with patients? I mean, people that went elsewhere or they've suffered for 10, 15 years with no results, and in one treatment? I mean, does that happen? Is that an overstatement?
Well,
one treatment?
It does. And even surprisingly is, with all medical information out there, the internet and so on, it's surprising too is how many people don't know that something can be done, or people who sought care before and were told, well, nothing could be done. Things have changed dramatically, and there is remarkable things that can be done for people.
But is it true that certain people get on certain medications and they just stay on those until they die?
Well, that's true.
Is that true?
That's true.
In medicine?
That's true. Well, that's true.
Okay.
But a lot of times, people either they're saying, well, I'm getting by, and maybe there are medications that would be better suited to what's happening. And again, as the technology and the pharmaceutical companies come out with better medications.
What is it, longer acting? I mean, is that the biggest change, new medications?
In some cases there's longer acting. In some cases there are medications that are faster acting that may be more appropriate for their pain. And then within our practice, probably half our patients, or maybe less, get medication management, and the other ones maybe get a therapy directed specifically at their pain that allows them not to have to take any medication before.